Now let's go through Protocol 11 for ELISA testing. This protocol for ELISA testing comes from the Carolina Biological Supply Company. This is their ELISA simulation kit. So it's a simulated ELISA test. It's not a true test because we don't want to be working with actual infectious diseases. So it's a simulated kit, and they provide the protocol. And also in the protocol, they give the patient profiles for the imaginary patients that you are testing for HIV. So in the protocol, it says HIV stands for human immunodeficiency virus. Is the virus responsible for causing the acquired immune deficiency syndrome or AIDS? HIV attacks and destroys a type of T lymphocyte of the immune system called CD4 cells, and thereby severely weakens the immune defense. Shortly after infection by HIV, the body begins producing antibodies against the virus, and the infected person may feel flu-like symptoms. The virus then enters a latent phase where the infected person does not experience symptoms, but the virus and the immune cells continue to attack each other. Eventually, the HIV virus gains the upper hand. The immune system loses its ability to fight off the opportunistic infections it could normally combat, and advanced AIDS results. HIV is communicable and can be transmitted from person to person through blood, pregnancy, breast milk, and other bodily fluids. So this protocol is kind of fun because it also gives you the detailed patient profiles for patients A through F that you're going to be testing for HIV. So patient A, it says patient A has learned that her ex-boyfriend was diagnosed with HIV. Although they often used protection when sexually active, she is concerned that she could have contracted the virus from him. And notice there that it says they often use protection when sexually active. I guess that means not always. And then patient B says patient B is the current boyfriend of patient A. Although they are not sexually active, they have engaged in deep kissing. Patient B is concerned for his girlfriend and for himself and decides to get tested along with her. Patient C is an EMT who treated a bleeding car accident victim who was HIV positive. After attending to the accident victim's injuries, he realized that his glove was torn and his hand cut. Patient D just broke up with her boyfriend after learning about several lies he told her. She worries that he has not been monogamous and decides to be tested for HIV. Patient E is happily married with young children when he gets a call from an old college girlfriend who is HIV positive. She does not know when she contracted the virus and is contacting all her old partners so they can be tested as well. And patient F experimented with drugs during college and used some intravenous substances. Although he has been clean and sober for years, he remembers sharing a needle with a friend at a social function and decides to be tested for HIV. Okay, now moving on to the instructions. So using one plastic pipette, carefully administer 3 drops of simulated antigen in each well of rows A and B of the microtiter plate. So you're going to be putting the antigen in both of those top rows, in every single well of rows A and B. And then you would discard the pipette after use. In a true ELISA assay, the antigen would bind to the bottom of the microtiter plate, and the wells would then be washed with a buffer to remove any unbound molecules. But since this is a simulated lab activity, that washing step is eliminated from this protocol. So then the second step, using a clean pipette, you would add 3 drops of positive control to wells A1, A2, and A3. So if you see in the picture here, these first 3 wells, A1, 2, and 3, are positive control. Then you discard that pipette. Then the third step, add 3 drops of negative control to wells 4, 5, and 6. Okay, so 4, 5, and 6 now are going to have negative control. Then you dispose of that pipette. And then finally, in the fourth step, using another clean pipette, add 3 drops of patient sample A into wells 7, 8, and 9. So that's patient A. And notice that you use 3 wells per patient and per positive and negative control, just to make sure that you have a good representation and you see the same results in all 3 wells for that patient, to make sure you have really accurate results. And then discard the pipette after you pipette patient A. And then continue using a clean pipette for each patient and dropping 3 drops of the patient sample into their designated wells. So this figure shows you where each patient's sample goes in your wells. And it's important as you add the samples from the patient into each well, don't allow the pipette to touch the liquid that's already in the wells. And then you would discard the pipette after each use for each patient. And in a true ELISA assay at this point, the wells would be washed with another buffer to remove any molecules that have not been bound to the antigen. But again, since this is a simulated activity, that washing step has been eliminated. Now that we have the antigen added to every well and the patient samples added to their designated wells, we're now going to use another clean pipette and add 3 drops of the simulated secondary antibody to every well, all the wells in row A and B. So keep track of each well as the reagent is added, and don't allow the pipette to touch the liquid that's already in the wells. You would then discard the pipette after use. In a true ELISA assay, the wells would again be washed to remove unbound molecules. Again, this step is eliminated. Then, using another clean pipette, add 3 drops of the simulated chromogen to every well of rows A and B. Make sure they're not touching the liquid that's already in the wells, and discard the pipette after use. So now you've added the antigen, you've added the patient's serum, then you added the secondary antibody to bind to their primary antibodies if they have them. And now you're adding the chromogen, which is the substance that will change color if that secondary antibody is bound to a primary antibody. So all the wells will turn light green when the chromogen is added, and then a change from light green to purple indicates a positive result in this test. Now, in different ELISA tests, there might be different colors, but the change of color shows a positive result. So you then incubate the microtiter plate at room temperature for a minimum of 5 minutes and a maximum of 10 minutes to allow for the color development. So after that 5 to 10 minutes of incubation, record your results in a table, which I'll give you on your results document, and compare the color of each patient sample to that of the positive and negative control that you'll also have on this plate. So colored results that are in between the positive and negative should be scored as weak positives.